Okay, we've been sent a case here for evaluation, and the note on the case is, I have planned this implant and would like your input. It is going to collide with the sinus as I have it planned, but very slightly. My thoughts that if I simply undersize the osteotomy and proceed as normal using guided surgery, it may be okay. Or would you plan an osteotome lift at this time, or would you consider the 8.5 millimeter implant and avoid the sinus altogether? I've never used, the note says, I've never used that short of an implant, and I'm not sure if that's a reasonable choice or not. Thank you very much. So let's start from the very beginning in this particular case, and the first thing I look at is if we want to do this guided, do we have all the information that we need? And based on this scan here, we have contralateral support, so this is a great situation for the OptiGuide. And we have very nicely integrated data, as we can see here in the axial view, so everything's good to go in terms of being able to fabricate an OptiGuide and ready to move forward. Now let's take a look at our plan here. So here are my concerns on this particular one. One is, this is your medial border of your sinus right there. The medial border of your sinus, and right here is your maxillary sinus right there. So at the end of the day, we're trying to do maybe a little bit of an up fracture right in this area here, but the risk that we take is that if we were to do this, and let's say we were to have an issue, we could technically break through this border right here and get into the nasal area, and I would prefer not to do that. So in this particular case, I would 100% go down to a shorter implant. It's just technically a little bit more safer. It takes some things out of play, and it leads to not having many issues in terms of any dental iatrogenic errors. So I would go to the smaller implant there. So now, with all that said, let's go ahead and walk through our planning here. Our plan looks pretty nice. If anything, I would critique saying that that is a little tilted up right here, and looking at that, so I would probably in this particular case go ahead and tilt that implant like so, bring that a little bit more level, and in doing that we move this to the mesial. So I would go ahead then and bodily move this implant back to the distal there, just like so, and now that's a little bit more level. And then other than that, that's pretty much it. The only other thing is maybe just a hair back to the center like that. Let's take a look at our CEREC design. So our CEREC design, again, the margins look great, good job. Our design looks pretty good in the sense that it looks like it belongs in the arch form. If we look at it, what I call the down the line view, if anything, we could possibly say that our buccal cusp is out right here a little bit. Again, just being overly critical, but everything else looks pretty darn good. So, other than that minor correction there, and going to the shorter implant, that's the only thing I would suggest in this particular case. So, congratulations, this case is ready to send off with some minor corrections. Thank you very much.